but RTI is really hard. I mean, it's really hard. So, and there are some rationale why we may not want to do RTI only. I do think we should have RTI, but for one, if we just use RTI, I would argue that that doesn't meet our requirement for comprehensive evaluation. So I've had some school psych friends in RTI heavy districts who've been like, I haven't done an IQ test in years. And I'm like, I'm not really sure that's good. You know, like we do need multiple sources of data, and we may miss some important things that are going on if we just qualify for SLD just based on a kid's performance on, you know, these curriculum-based measures. Also, we've done a lot of great research on RTI in the lower grades. Our research in the upper grades is limited, especially, you know, in middle and especially in high school. So one of the challenges we have is, you know, in Kentucky, districts are kind of directed to choose. Are you going to be RTI or are you going to be ability achievement? Well, RTI makes great sense for the elementary school, and hopefully we're catching learning disabilities in elementary school. But for our really bright kids, we may not be catching it till high school, and it's really hard to implement RTI well in the upper grades, and there's just not a lot of great research to give us guidance on what to do. Also, curriculum-based measurement doesn't capture all of the skills we really need to be good learners in high school. We need a lot more complex reasoning at the high school level. And it's just harder to do quick, you know, CBMs at that level. If we're looking at measuring letter recognition, sure, that's simple, that's easy. If we're looking at being able to effectively put together a term paper, I mean, that's a little harder to measure. So I have some memes about data and a disclaimer. I pulled these off the internet, but I know that data are plural. I know it's data are, but I cannot find memes that say data are. They all say data is, but anyway, that's a side note. But in order, why I have Oscar to the Grouch out there is that this is one of my, you know, pet peeves as a psychologist. If we want to make good database decisions, we have to have good, reliable, and valid data sources. If we get garbage in, the decisions that come out are going to be garbage too. So anyway, sometimes this is what RTI feels like if you're a parent, right? Or if you're a teacher who's like, you know, I'm really concerned about this student. I really feel like we need to be looking at special education services. And this isn't supposed to be how it works, but this is what it can feel like. So the patterns of strengths and weaknesses. So the idea behind that is that achievement deficits, you know, make sense within a pattern of psychological processing strengths and weaknesses. So they would say that, kind of like I said, ability achievement is wait to fail. They would say RTI is just watch them fail, right? You know, and so people in this camp say that, you know, we need to look at cognitive processing, we need to look at academic achievement, and we need to look at the whole picture, which I do agree with. I think the whole picture is a great thing. I love data. The more data, the better. Bring it on. And they do agree, again, that RTI is important for preventing learning problems. We need to be doing this. Once we're concerned about a learning disability, though, we should have a comprehensive evaluation. We shouldn't just be diagnosing learning disability based on response to intervention alone, based on these curriculum-based measures. We need to look a little deeper into what's going on. They also argue, too, that if you're a kid with a specific learning disability, you need individualized interventions. And in order to provide these individualized interventions, we have to have a little bit more of an idea of what exactly is going on, right? So the reason why this kid wasn't making progress in response to intervention is that the standard research-based interventions weren't working. So we need a little bit more information and understanding to determine exactly what's going on in order to individualize intervention and support for this child a little more. So the proponents of processing strengths and weaknesses say that, you know, that They may be in one or more of these areas. And I will say that when I've evaluated children for learning disabilities, a lot of the children I evaluate do not have a straight up lovely cognitive profile. A lot of times when I evaluate kids for ADHD, their sub-skills that make up the cognitive or intelligence test are all over the place to the degree that I throw the full scale IQ out the window and just say the full scale IQ is meaningless because of the degree of strengths and weaknesses we see in this profile. And I will say, I'm trying to decide if now's the time I want to throw my husband under the bus or a little bit later, but I did give him fair warning. So my husband is a brilliant man. He's a professor at Transy. He was in gifted education as a elementary school kid, but he cannot do calendars. He does not understand them. They make no sense to him. If you throw a day or a date of the week at him, he cannot map in his brain how that relates to time and space. He struggles with this so much that he missed proctoring his own final a couple years ago. I manage our family's calendar. I have to send him calendar invites for everything. We have to have calendar meetings every Sunday to kind of map things out. And he also can't spell. He cannot spell. He never was diagnosed with a learning disability, but through the gift of word processing, and I've been with him since he was 18. So somebody to like manage his calendars, and help him. So, he's been okay, right? But in terms of this profile, I would say, he's got a processing weakness, right? And a deficit in academic achievement, right? So that's, a way in which that can kind of map out. And maybe there's some relationship in the brain between the calendar and spelling. I don't know. We don't have really enough neuroscience knowledge to back that up. Working memory. Working memory is critically important for so many things, but if you have working memory as a processing weakness, writing a paper is going to be really, really hard. You have to hold so much information in your head in order to get it out in an organized, coherent way when you're writing a paper. Also, when you are reading, you have to hold information in your mind about what's going on in the story in order to comprehend what you're reading. So with kids who struggle with written expression and reading comprehension, you're going to maybe find some impairment in working memory, for example. Visual spatial deficits, you see a lot in kids with learning disabilities in reading or dyslexia, right? They're just the way the letter is shaped is not pairing up with the sound that it's supposed to make, or the way that the letter is shaped is not clicking, right? There's you have reversals from B's and D's past when you would developmentally expect it, for example. You also see kind of visual spatial processing deficits when it comes to math disabilities as well. So those are just some examples, but again, we don't know, are those processing deficits, are they a correlation? Are they a causation? Are they an outcome? Like it's really hard to tell with the research that we're able to do. And it doesn't always imply we have a functional impairment. Again, my husband has been just fine. He has a PhD. He's a tenured professor, never had a diagnosis of a learning disability, but I could tell you as a psychologist and his wife, he probably does have one. The U.S. Department of Education they put out, I believe in 2006, kind of questioning this approach. If we have a kid I've also tested kids that have a totally flat normal cognitive profile and they have an academic deficit in one area. Do we say, well, that kid doesn't have a learning disability? I mean, I don't know how fair that is. And this may be less sensitive to children with more low average or below average cognitive abilities. You may not pull up this strong pattern of strengths and weaknesses as you would with somebody with higher IQ. So that's that's what that looks like in terms of our famous screaming lady and cat meme. Okay, so going to the DSM. The DSM-IV, which is what was in place when I was in graduate school, defined a learning disability as an ability as measured by an individually administered standardized test, most likely an IQ test, or no, most likely an academic achievement test, is substantially below that expected given the person's age or intelligence or age-appropriate education. So the previous edition of the DSM did use the ability achievement discrepancy. The current DSM does not. So, and this came out right about when I was getting licensed, like 2012, 2013. I remember because I squeaked in doing my licensing test on the old DSM before I really had to learn the new one. But I learned the new one, don't worry, I am a professional. So we switched from disability to disorder, I think partly because we're conceptualizing a specific learning disorder now as a neurodevelopmental disorder, as a disorder that occurs during the development of the brain, along with ADHD, along with intellectual disability, along with speech and language impairment, along with autism spectrum disorders. All of these are conceptualized as neurodevelopmental disorders. The DSM does give us a time frame for response to intervention. It says these difficulties have persisted for at least 6 months, despite the provision of interventions that target those difficulties. It does use the dual discrepancy. So we have academic skills that are, substantially below, what's required for that person's chronological age. And so we have, we're given interventions, they're not making progress, their abilities are below, what would be expected. For individuals over 17, you could use just a documented history of learning difficulties that could be substituted for doing response to intervention. So, this is the new diagnosis we have. I am a proponent of RTI. I have parents coming to our clinic who want me to test their child for a learning disability. And really, if I'm going to do my job as a clinician, I can't really test their child for a learning disability without the school, because the DSM says response to intervention. I can help provide data, I can help argue a case that this child may have learning disability with the tools that I have, but without really collaborating with the school on providing evidence-based interventions and monitoring progress, it's really hard, for a clinician to do that diagnosis. If I was in private practice, I could set up, a testing and intervention service kind of all in one. The issue with that is that insurance won't reimburse for that. Insurance is even if I try to do any academic assessment as a clinician, insurance pretty readily denies it because they argue that the school should be doing that. And they're not, insurance companies are not wrong. The school really should be doing this. So it's pretty challenging to kind of get this diagnosis clinically independent of the school. Pretty much need to have the school involved. IDEA says a specific learning disability is you either have a pattern of strengths and weaknesses in performance, achievement, or both, relative to ability level or intellectual development. So I take that as, my interpretation of that is that we don't have to be rigid in terms of ability, achievement, discrepancy. We can look more broadly at the pattern of the profile we're getting in terms of my interpretation of what IDEA is saying. Or IDEA also gives us the option to use response to intervention as well. We're looking at the rate of learning. The National Association of School Psychologists, among others, really pushed hard for response to intervention to be included in the reauthorization of IDEA. So our field, my field, the school psychology field, has really been a strong proponent of this and a strong proponent of this being included in special education law. We do, in terms of both of these definitions, rule out intellectual disabilities. So again, you know, when I have people saying to me they haven't given an IQ test in a long time and they just diagnosed a learning disability based on RTI, you know, in the back of my head, I'm like, what if the kid really has an intellectual disability? Wouldn't we at least want, you know, a cognitive assessment to kind of rule that out? And we also need to rule out vision, motor problems, hearing problems, right? If you can't see, if you can't hear, it's going to be pretty hard to learn, right? How to read and how to write and how to do all that kind of stuff. It's going to be hard to learn how to form letters if you have a motor deficit. So we need to rule those things out as well. And they also advise kind of looking at emotional and behavioral difficulties as well. So, and I'll get back, I'm going to jump back to DSM here for a second. And I have this little stool because, and this is an homage to the Kentucky Department of Education as well, because KDE has been very consistent in saying we need triangulation of data. A stool cannot stand on one or two legs. So that's why I have our one-legged stool here. And the DSM-IV says this as well. We need triangulation of data. We need to look at these things from multiple angles. The DSM-IV does not argue against using psychometric testing. And in fact, it says, you know, we need to look at academic skills as measured by psychometrically sound and culturally appropriate tests. The DSM-V also says any threshold is really arbitrary. So in a sense, you know, it's up to clinicians to use some sound clinical judgment to determine what underachievement really is, what a slow rate of learning really is. You could say 1 standard deviation, you could say 1.5, you could say 1.25, but basically you have to be able to back up whatever decision you're making. Learning disorders can also occur in the gifted population, and you may not see the expression of these learning disorders until the demands get higher. You may not see it come out until high school or sometimes even college, or sometimes until you have to manage a calendar, right, as a professor. But anyway. But basically, no single data source is sufficient. And it remains, you know, really, in terms of processing deficits, like I said, we just don't know enough about what role those play to use them really as a diagnostic criteria in and of themselves. Yes, they're definitely informative, but should we, you know, necessitate that be part of the profile? I don't know if that's necessarily fair. Okay. So what do we do in Kentucky? We have two choices, and it's, you know, up to the localities to determine that typically this is a district level decision. So we either do severe discrepancy as defined by the discrepancy tables, or we do response to intervention. I mean, so I operated as a school psychologist in Kentucky in a district that used response to intervention. And I was at a high school, and I should absolutely love this because I really believe in response to intervention. I will tell you, it was really hard as a school psychologist in a high school to do a reevaluation of a kid with a learning disability using response to intervention because we just don't have good research and good tools at that level. And maybe I can say this now because I'm not employed by Lincoln County anymore, but sometimes I was kind of left with having to do, you know, a comprehensive assessment, looking at their performance in class, looking at their performance on district and state level standardized testing, you know, looking if they were selected and put in any particular extra intervention classes, and also looking at the pattern I saw with cognitive and academic achievement, because it's hard to do true RTI at the high school level. So I will say that. I will own that I kind of did RTI/pattern of strengths and weaknesses, maybe as a school psychologist in the high school level. Because I mean, it's hard to do at that level. We need to, now these are, and this I'm getting from, if you want to go kind of for more guidance, there is a special ed specific learning disability guidance document published by the state. And if I would recommend, you know, if learning disabilities, which if you're at this talk, there's something that matter to you in this state, you know, recommend that you read this document. So we exclude vision, hearing, and motor impairment. We exclude lack of appropriate instruction. So, you know, if you're not going to school, if you have a lot of absences, it's pretty hard to document that you've had appropriate instruction, for example, which I would say would be probably the #1 reason why a kid would not be diagnosed due to the lack of appropriate instruction would be due to absences. Limited English proficiency. And so if we have an English language learner, sometimes in the schools, it will take longer for that child to be diagnosed with a learning disability. Although I would argue that if a child has a learning disability, they could be assessed, if possible, in their native language, and you would still expect to see some impairment if assessed that way. Of course, intellectual disability. You also want to make sure that the learning disability, or that the deficits in learning aren't due to an emotional behavioral disability. Although, if you have a learning disability, it would make sense that you would act out more, right? So, I mean, if I was frustrated every single day in the classroom, I would probably be a thorn in my teacher's side. So I think, you know, we need to look at emotional behavioral disability, but we also need to be careful in considering to what degree is this an authentic academic impairment, and to what that, you know, we see some emotional and behavioral reaction to it, or to what degree is the emotional behavioral disability contributing to the difficulty in the classroom. Another exclusionary factor is cultural factors. I looked in the guidance document. I'm not entirely clear on what is meant by that. And then environmental and economic disadvantage. So, you know, for example, if you had, you know, a kid coming into kindergarten who hadn't been to preschool, and, you know, they were really struggling to get going with learning to read in the first couple of months, you know, we probably want to do RTI before jumping on saying this child has a learning disability. Okay, so severe discrepancy. All right, so if you read the Kentucky Administrative Regulations, it says a severe discrepancy is a child exhibiting a pattern of strengths and weaknesses in performance, achievement, or both relative to ability level or intellectual development. So that's kind of coming straight from IDEA. We have the pattern of strengths and weaknesses. But then our method is a severe discrepancy between intellectual ability and achievement. And I just have a really hard time with this, because I really feel like the method is not an accurate operationalization of the definition and the administrative regulations and the definition of IDEA. I think it's overly rigid, which is one of the reasons why I have such a hard time with it. Anyway, I feel, you know, yes, we could, it's kind of a reliability without validity problem, right? Like if we use the ability achievement discrepancy, we could probably, you know, reliably pick up on this kid, you know, if we assessed him, you know, this year, or, you know, maybe later, or maybe with, well, maybe, but is it really valid in terms of what a learning disability is to rely on that? Are we really going to capture kids who have a learning disability if we rely on that rigid of a definition? And I really worry that we don't. And I have to include some memes from Elf because it's Christmas and it's a Christmas movie I watch every single Christmas. And who doesn't love a golden retriever dressed up as a tiger? But So the severe discrepancy model, this rigid ability achievement discrepancy, dates back to the Office of Special Education at the federal level guidance from 1977. So that was before I was born. So, you know, it's not current or based on current research. If you want to find the discrepancy tables, you can maybe sense my increased agitation. And again, you know, it's partly the way I was trained, but you can find them here. And so I think you can kind of look, it'll tell you, you can kind of go by which tests were used to find the discrepancy, the particular discrepancy table. So as a psychologist, I don't know, I just love my choices. And when it comes to the discrepancy tables and the disability achievement discrepancy model, we only have a limited number of choices in terms of the tests we can use. The WISC-5 being one of them. And there has not, if you look at the research on the WISC-5, there has not been good research done by people outside of the test publisher on its factor structure. The only factor that really is kind of reliable and valid on the WISC-5 is the full scale IQ. And I don't think the full scale IQ really does a service to a lot of kids with learning disabilities, because sometimes you'll see a varied profile. So I don't like the WISC-5. I hope the WISC-6 is better. The KABC-2, they recently came out with a normative update. You have kind of 3 different options there regarding what scale you use. My preference has been the MPI, just because it takes out the knowledge piece. So in a lot of these intelligence tests, vocabulary and cultural knowledge is a factor. And I like the KABC because, and I liked it as a psychologist in Lincoln County, because for my kids who have never left the county, I could take out kind of cultural knowledge as a factor. I mean, because my kiddos hadn't really experienced much outside of their locality, and that knowledge piece would sometimes just depress their score. So I liked with the KABC being able to take that out. At the same time, some psychologists will tell you too that the KABC inflates IQ scores as well. The WACE is the adult version of the WISC, but the WACE-4 doesn't have the same trouble as the WISC-5 does. And it's used basically ages 16 and up. We only have the option to pair that with a Y-3, although I will say, you know, that's an achievement test, and as far as achievement tests go for high school age kids, that was my favorite one. But we can only use the full scale IQ, and I don't like being restricted to the full scale IQ, and I'll show you why for a minute. The DOS I don't have as much experience with, and then you can of course do the Woodcock-Johnson, which I just always think it's funny to say that name. But you can do that. There's both. The Woodcock-Johnson also puts out a cognitive test and an achievement test. And I'll talk about it in a second. Fresh, hot off the presses in school psychology, there is an article on the use of the Woodcock-Johnson that just came out November 2019. So I was pretty excited to read that right before this talk, and I'll talk about it in a minute. So this is what a discrepancy table looks like. So let me tell you the reasons why I have a hard time. So one, when it comes to IQ and achievement, there is error in any measurement. So when we present our scores, as a psychologist, we'll give you a confidence interval. We'll say there's a 95, you know, this is what their score is. Their score is a 100, but there's a 95% chance that their true score is between 95 and 105, right? And wherever they get in that range may just depend on, you know, the factors of the day. we don't have the option of looking at the standard error of measurement on these tables.